Hi, good evening. Please tell me your name and what you do.
My name is Dr. Frank Alvarez-Gil. I'm a board-certified anesthesiologist, diplomat of the American Board of Medicine, and I practice clinical anesthesia. I also used to be a professor at the University of Miami teaching, and now I am the medical director and chief of anesthesia at Bayside Ambulatory Surgical Center.
Okay, so my first question is, as a physician, is the study of the skeletal system something frequently used other than orthopedics?
Absolutely. The study of the skeletal system creates the vocabulary of medicine. And that is the way we communicate with fellow professionals as to where disease, injuries, etc. lie, so that we can very accurately understand each other through the understanding of anatomical term specifically to the skeletal system.
How, as an anesthesiologist, does the knowledge of the skeletal system help you?
Actually, that's an excellent question, because most people think that an anesthesiologist is puts people to sleep and call it a day, and actually that's true, but another very important part of anesthesia is regional anesthesia. And it is through the knowledge of the skeletal system that we can approach different types of anesthetic blocks to the extremities, both upper, lower, etc. That understanding location of the anatomy guides our needle vis-a-vis ultrasound to be able to create an effective block.
How does anesthesia impact the skeletal system during surgical procedures?
Actually, people may not understand that the anesthesiologist is the patient's guardian during surgery. Therefore, understanding the anatomy so that we understand where patients need to be cushioned so they don't get injured during anesthesia is very important. I cannot emphasize to you how the knowledge of the skeletal system helps the anesthesiologist protect the patient.
When dealing with patients with skeletal trauma, how does anesthesiology contribute to minimizing pain and supporting the surgical team's efforts?
Actually, that is a very good question, again, because many times when we are encountering a patient, especially an elderly patient, that has, for example, a total shoulder fracture involving the humerus, the clavicle, they may not tolerate the post-op narcotics as well as a younger patient. So what we do as anesthesiologists, besides performing a regional anesthetic block in the brachial plexus, which is related to anatomic landmarks that blocks the entire shoulder and arm, we also insert catheters to provide pain relief medicines, in other words, slow infusions of local anesthetic that don't require narcotics and keeps the patient comfortable 2 or 3 days post-operatively to allow the recovery to take place that much quicker.
Now, let me ask you a more general medical question. How does physical activity impact the skeletal system, and what exercises are beneficial for bone health?
This question actually is so important in our society where we have an increase in the number of the aged. Doing weights, concentric exercises where you do weights, it helps stimulate bone growth. It is interesting that one of the big problems that the astronauts used to have when they were in zero gravity, sometimes for months, is their bone density will be diminished because they did not have any gravitational pull on their bones, and therefore didn't have any stimulation of osseous formation. Osseous formation is very important in fighting osteopenia, which is bone density diminishing, or porousness of the bone called osteoporosis. And exercise, specifically doing light weight training, is very important for the aged, and also for people of all ages, but specifically for the aged.
Are there specific dietary recommendations to support bone health?
Yes, there are. Obviously, first of all, very important, and sometimes we take it for granted, it's being outside in the sun. That stimulates bone development vis-a-vis vitamin D. By taking vitamin D supplements and calcium supplements, sometimes very naturally through dairy products. And now some evidence is showing taking supplements called turmeric does help, and glucosamine and chondroitin are very helpful in not only bone but joint health.
What is the significance of joint health in relation to the skeletal system, and how can one maintain healthy joints?
Well, first of all, you have to listen to your body. Whenever you're exercising and you have joint pain, you need to stop the exercise, rest, and not try to work through pain, because that usually leads to damaging joints. Now, if you're blessed with not having arthritis, specifically osteoarthritis or rheumatoid arthritis in your family genes, doing a combination of not just aerobic exercise, but weight training does help joint health. And I think I mentioned in a prior question that glucosamine, chondroitin are very important for bone health, as is turmeric.
How does age affect the strength and density of bones in the skeletal system?
Well, as one starts marching through life, by the 5th decade, and more specifically women more than men because of endocrine issues of osteoporosis, and which means porosity of the bones, and osteopenia, which means diminishing bone density, plays a big role. For preventive health, one can monitor these issues doing blood tests that indicates people who are predisposed to bone density issues. And they can then take different types of vitamin D supplements like vitamin D1, vitamin D3 to help fight osteopenia, in addition to doing weight training exercises that can stimulate bone growth.
Okay, and my last question for you today is, do you think the knowledge of the skeletal system is useful in fields outside of medicine?
You know, the simplest answer is yes. But why yes? You may say, well, I'm a musician. I don't need to know about skeletal system. I'm going to study English literature. I don't need to know about the skeletal system. But knowledge of the skeletal system is knowledge of self. And it is the vocabulary that you can better articulate about yourself in communicating issues with physicians, or in emergencies, communicating to first responders in emergency you come upon. So yes, I think enriching somebody's life with the knowledge of the vocabulary of the skeletal system is mission critical to live in this world.
Thank you so much.